So about a year ago, I uploaded a video named it Phlebotomy Basics and had to take it down because I had some artwork in it that was not mine, but you know, you live and learn. So I've decided to put this video back up because it's a highly requested one, and yes, here we go. For me, I have always said that phlebotomy to me is the most underestimated procedure in healthcare. It's very invasive. If you do not know what you're doing, poorly performed specimen collection procedures can lead to life-threatening medical mistakes. Phlebotomy is an invasive procedure that is not at all as simple as some make it look. Number 3, patients can actually suffer permanent disabling injuries at the hands of the unskilled. A lot of these things are taught in school, or I should say a lot of these facts are taught in school, but I think once we get into the field, it's important to remind ourselves of these facts, because if you are not focused and paying attention to what you are doing, you could actually injure someone performing a phlebotomy procedure. Basic venipuncture. There are 8 components for a successful venipuncture. Number 1 is proper patient identification. Number 2 is proper site selection. Number 3, proper site preparation. Number 4, your tourniquet placement and how long you keep it on. Timing is important. Needle selection is important as well. Number 6, tubes. Your order of draw, of course, is very, very, very important. Labeling your specimens, number 7, and handling of the specimens is number 8. Very, very important facts for a successful venipuncture. Your patient identification should always include 3 identifiers: your patient's first name, your patient's last name, and your patient's date of birth. You must confirm with appropriate ID and always be pleasant and confident, because not most times you have to ask this particular information 2 to 3 times before the patient is let go out of your area. And never, never, never rely solely on verbal communication only from a patient, because if you're in a hospital, sometimes patients are medicated heavily and they will say just about anything. So never, never rely solely on a patient. Always double check your paperwork. So now I want to go over the acceptable sites for blood collection. The number 1, I guess, we'll go over the anacubital area of the arm. This is where your median cubital vein is, your cephalic vein is, and your basilic vein is located. These are the 3 veins that you want to go for first. And yeah, because they're easier. So the anacubital area of the arm includes the median cubital vein. It's a superficial vein most commonly used for venipuncture. It lies over the cubital fossa and serves as an anastomosis between the cephalic and the basilic veins. And it's most times in most people it's a little larger. So your cephalic vein, shown in both forearm and arm, can be followed proximally where it empties into the axillary vein. And your basilic vein in the forearm and arm divides to join the brachii. So number 2 would be the back of the hand or side of the wrist. And 3rd would be back of the hand, side of the wrist, and anacubital area below an IV line. The 4th place you want to look as last result, only at the discretion of a physician or nurse, would be to collect above an IV line. But the physician or the nurse must turn that IV off for a minimum of 3 minutes before you collect. You always want to collect a waste tube when collecting under these circumstances. Your waste tube is always usually a plain red top tube. It's the 4 ml plain red top tube, and you just trash it and then draw the tubes that you need. But you always want that IV off if you're going above the IV site. You never, never, never want to collect from areas where edema is present, where veins are scarred or sclerosed, extremities that appear bruised, reddened, swollen, or infected, above a catheter or IV. Other unacceptable sites include fistulas, shunts, arterial lines or locks, arteries, femoral vein, varicose vein, and the palmar region of the wrist, that inside area of the wrist. When you turn a patient's arm over or you look further down and those veins look nice and juicy, no, 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 no. Stay away from those. Even when they say, oh yeah, go ahead, someone else drew there. Nope, not gonna be me. So site preparation is also important. You want to select your venipuncture site very carefully. You want to prep and cleanse the skin surface in a circular motion with alcohol wipes, and we all know ETOH is alcohol in the laboratory. And you want to let the site air dry. Never blow, never fan. Sometimes the patients will do that, and I just tell them, you know what, in a nice, jokingly friendly way, we're going to do this again, and we're going to let it air dry. So, no help. Thank you. I make a lot of fun with my patients. So your tourniquet placement is just as important. You want your tourniquet placed 3 to 4 inches above the venipuncture site. You only want the tourniquet to stay on the arm for 1 minute. I've been corrected here because I've done 1, maybe 2 videos where I did not have it 3 to 4 inches above the venipuncture site, and I probably took it off or left it on a few minutes longer than a minute. Not 2 or 3, but a little past a minute, and I was told so. Anyway, my test dummies, I have to do what I do. Your needle selection is also going to be very important. The 19 to 23 gauge is the most commonly used, and that 22 and that 23 gauge can also be used in children. And most importantly, when choosing your needle, it's important based on the amount of blood you're going to draw, the age of the patient, and the size of the vein. So there's a lot that goes into selecting a needle. You don't just pull a needle or the same needle for every patient. You really, really need to take your time. So that straight needle versus the butterfly is such a big thing. The predominant technique used to draw blood for laboratory testing, as you all know, is the conventional straight needle attached to an evacuated tube system. But alternative tubes might be advantageous in exceptional circumstances. The wing sets, the butterflies, are particularly useful when multiple tubes of blood need to be drawn over a relatively short period of time, when a patient's veins are small or in poor condition, and when a patient is unable or unwilling to cooperate with the procedure. The elderly, neonates, and pediatric patients frequently fall into these categories. So it's really going to depend on you, what you're comfortable with, and you're going to assess this patient, so it's really going to be up to you to determine what to use. And you guys know that in my videos I basically gravitate toward the straight needle, and that's most times for just about everyone that I draw. But of course, if I have someone combative, someone kind of out of it, from medication, a small child, yeah, I go for the butterfly. But it's not my first choice. I never just pull a butterfly and use a butterfly for everyone. It's really not. It's not. You don't need to. So features to consider during the evaluation includes, of course, ease of vein access, angle of needle insertion, needle penetration depth, the venous probing, the ability to withdraw from the vein, the ability to visualize flashback, which helps a lot of people, patient comfort, and safety. So the use of butterfly devices has been discouraged for reasons, but it's all up to you because you are in charge of the situation. That's what I like to tell everybody. So it's basically your call. Don't do what everyone else is doing. Do what feels best and what's right for you. So I think the venipuncture, of course, is to visually inspect the needle tip before inserting. And if you don't know the term bevel up when you come out of school, you need to go back into school. So bevel up, when you look at that needle before you start a venipuncture, the bevel should always be up. And never encourage patients to pump their fist. I know you hear it, you see it, but it's really not encouraged nowadays because vigorous fist pumping leads to hemoconcentration, and it can usually affect your potassium levels, protein levels, and cell counts. Anchor the vein by pulling the vein skin taut. I have a video on that. And for normal venous punctures, the best angle is between 15 and 30 degrees. When the needle enters the vein, you'll feel a slight give or decrease in resistance, and that just kind of helps you know where you are. Your order of draw, I have some information right here. You guys can look over it real quickly because I think the slide goes pretty fast. But there's a video also for that I will link down below. And you guys can go over that. Of course, you know your blood cultures. Anything that's going to go to microbiology is going to be collected first, i.e. here, of course, your blood culture tubes and bottles, so that they're sterile for microbiology. And your tubes with no additives, of course, are going to follow your red top tubes. Your tubes for coagulation studies are going to follow those red top tubes. Of course, your coagulation studies go in blue tops, the light blue. We do have a royal blue, but that's not what we're talking about. The next draw is the tubes with other additives. So you're going to go from your blue top to your gold top, etc., etc., etc. You want to fill the tube. So filling of tubes, each tube contains a specific amount of additive for a specific volume of blood. So underfilling these tubes can cause erroneous results, and you don't want that. So always fill your tubes completely. Let the vacuum stop the tubes where it's supposed to stop it. And when you're using the winged set for venipuncture and coag, it's best to draw a discard tube. That is that blue top tube, so that you don't get that dead space in the tube, and so that it fills completely when you're using them. Sometimes with those wing top, the butterflies, you get dead space and they don't fill. So it's always important to pull that red top before you pull your blue top. Processing of these tubes, mixing of specimens and inverting the tubes gently. We do not shake tubes. Your blood cultures, bottles, and tubes, you want to invert them 8 to 10 times. Those blue top tubes, you want to invert them 3 to 4. Gold top separator tubes, 5. Your serum tubes, those big 10 mLs, you really don't have to invert them, but if you have like all these different colored tubes in your hand, it's not going to hurt them if you do. So your heparin tubes, 8 to 10, your EDTA tubes, 8 to 10, and your glucose tubes, if you ever draw the gray top tubes, and they're also inverted 8 to 10 times as well. So you want to begin the above process immediately after drawing your blood, because improper mixing can cause platelet clumping, clotted specimens, hemolysis, microclots, and all those things we can't see with the naked eye. But once it gets to core lab, of course, they'll be calling your lab or the phlebotomy area complaining about specimens being mishandled. So always mix and invert your tubes the way that they should be. It's very important. A lot of people overlook this step, but immediately after pulling your tube from the holder, you want to gently invert them. It's very, very important. I really can't say enough about that. So I think labeling your specimens, of course, is just as important, guys. You really, really have to ID these patients and label these specimens. This is like so super important. People get laxed when it comes to labeling, but this is where you can miss ID if you do not get that patient's full name, medical record number, date of birth, and put the date and time the specimen was collected on it, and put your initials on it. So identification and specimen labeling after the blood collection is critical for patient care. Never label your tubes before you draw them. That, even when I say that sounds so wrong to me. It just makes no sense. You never label tubes before you draw. Anything can happen. You can be called away. Tubes can fall. I mean, it makes no sense to label a tube before you draw the blood. Any of those things can cause recollects, reanalysis, misdiagnosis, malpractices, and labor costs, because the patient has to labor costs, of course, the patient has to be restuck. But let's not get into malpractices and misdiagnosing patients. That's a whole different subject. Once all of this is done properly, guys, you want to handle your specimens properly, and the National Committee of Clinical Laboratory Standards, NCCLS, you want to follow those. You also want to adhere to OSHA, Occupational Safety and Health Standards. Both committee guidelines require a transport bag to have a biohazard logo, a liquid tight closure, and a slip pocket for paperwork. And I have videos on that as well. I hope you guys really enjoyed this video. Like I said, I put it up before but had to remove it for some things that one particular thing that I used. I don't have any artwork in it, as you can see. I took all of that out, but there will be references down below. I'll reference some some pictures for you to use. I'll even throw in some links to go to some of my videos that I have if you've not seen them. And I just want to thank you guys so much for always supporting me. Don't forget to thumbs up the video. Don't forget to subscribe if you haven't, and welcome to all my new subscribers. Thank you guys so much, and look forward to more phlebotomy videos because they are coming. Thank you guys. I'll see you in the next video. Bye.